I'm Raquel Mendoza. I'm going to be going over burn dressings. Going to talk about burns on admission. So we want to make sure to shower and shave all burn wounds daily prior to surgery. The hair follicles harbor bacteria and therefore increase the risk for infection. The face and the neck, you want to use bacitracin ointment and Owens gauze on the face. There are different ways to apply the Owens gauze, but as long as you put the bacitracin on the face first, and then you're going to put the Owens gauze on after. On the eyes, you're going to use ophthalmic bacitracin and antibiotic drops if corneal abrasions are present. For the ears, you're going to use sulfamylon cream or bacitracin ointment if it's a superficial burn. For the extremities, the trunk and the genitalia, you're going to use Xeroform and bacitracin. SSD can be used for major burns in the ICU for unstable burn injuries, but again, it's only for the ICU. Now we're going to go over some of the grafts. Xenograft, you're going to be taking it down every, takedown is 2 to 3 days. Xeroform only, no bacitracin. The donor sites are going to have Mepilex AG. You're going to change that every 7 days, and PRN is saturated and also prior to discharge. You're going to remove the Mepilex with bacitracin and Q-tips, so you're going to pick it up at the edge, and with a Q-tip that has bacitracin on it, you're going to slowly apply to that and slowly pull it off. You don't want to rip or peel it off. For infected grafts, you want to monitor them for infection, any fruity smell or discoloration. You're going to be using a sulfamylon solution or Dakin solution, and that would be every 12 hours you're going to be changing the dressing, and you're going to soak them every 6 hours. And this is for the use of infected grafts and donor sites only. Also, sulfamylon cream can be used, so you're going to use bacitracin and or nystatin powder. You're going to spread the sulfamylon cream onto the gauze, and you're going to sprinkle the powder on. For autografts and allografts, split thickness skin grafts, takedown is day 3. If you have multiple grafts on one extremity, you can ask the physician if they can be taken down on day 2. If you have another graft that needs to be taken off day 2 versus day 3, they can possibly be taken off at the same time. Just make sure you have a physician order. For sheet STSGs over the face, joint, hands, and feet, the takedown is day 2. You're going to monitor for hematomas. You're going to evacuate if needed with an 18-gauge needle. You're going to change the dressings with bacitracin and Xeroform. The goal is to allow for the graft to dry in order for underlying skin to evolve and epithelialize. Stable removal, you want to obtain orders and discuss the time frame so those are not missed. Also, with grafts, we want to make sure that we protect the grafts and not shear. So we don't want to apply direct pressure to the graft, and we want to use padding with the splints. And if you need to use restraints, please use loose restraints in order to reduce the shearing of the grafts. Integra is a bilayer skin replacement system. Inner layer matrix of bovine and collagen. Outer layer is silicone. Closes wound rapidly, early mobilization, allows for autografting 3 weeks later, and almost no contractures or hypertonic scarring expense, and it is expensive. I'm going to go over some of the secure dressings. The figure 8 is the shoulder securement. You're going to use Curlex to wrap one side of the shoulder, and then you're going to crisscross it around the back onto the other shoulder. Also, you can use Intersorb. You want to use that diagonally instead of horizontally to place it over the shoulder, and you can also use a stretch net. And some other people who are very creative can use ties from the yellow gowns to secure the seams, and they can stretch the vest to the sleeves and also to briefs and to leggings. The tip is to wrap the Curlex higher past the joint and secure with stretch net to prevent sliding down with a range of motion. The XU dry dressings, they wick away moisture from wound sites. They secure the torso dressings in place. They help protect the skin and can be used to secure wet topical solution dressings. Please be sure to assess for drying that may require additional saturation. Hands and feet, we're going to use Conform and the boxer wrap technique, but again, that's for hands only. I'm going to be demonstrating the box wrap technique for hand burns. And we are going to pretend that this is SSD. So you're going to apply the SSD actually to the gauze. All I did was open it once, spread it on the gauze, and then you're going to lay this portion on top of the hand, and then you can wrap this here. And you can do this multiple times if you have multiple fingers that are burnt. And then, like I said, you can continue doing that once if you have multiple fingers that are burnt. The main thing is to make sure that you anchor at the bottom. I'm going to do this upside down. And you want to wrap distal to proximal. And make sure that you are not wrapping too tight because you don't want to constrict flow. And also want to make sure that the fingers are kept apart to allow for movement. You see, I'm always coming down to the bottom to re-anchor the conform. I'm trying not to make this too thick. And then you can cut it here. And as you see, her fingers, you want to make sure that there's not too tight and that her fingers are separated, again, to allow for movement. And that's it.
Good job.
The best feet dress individually, not wrap, because it constricts the movement when ambulating. So you are not going to individually wrap the toes, and you are not going to use stretch netting as well for the toes or for the fingers to keep the dressing intact. So no stretch netting for stretch dressings for fingers and toes. All other extremities, you want to use Curl-X in the inner sword. Make sure to wrap distal to proximal and secure dressings with a stretch net or tape, and again, not over the fingers.